Hi guys, my name is Dr. Bashir and welcome back to my channel where we discuss simple oral health tips. Today we are going to be discussing how to eliminate bad breath, what we call halitosis in medical terms. Bad breath is a bane in our society. Once you have bad breath, it becomes difficult for you to interact in social gatherings, at meetings. Your social life is restricted, you can't smile, you can't laugh outside, then your self-esteem becomes low. So it's a very important thing that many people have wondered how to eliminate it in their mouth. So this topic is for you, and I'm here to tell you simple step-by-step ways to eliminate bad breath in your mouth. It is important to note that 90% of the causes of bad breath is from poor oral hygiene. So I'm going to give you some tips on how to maintain very good oral hygiene. The first one is, please make sure you brush 2 times daily, minimum twice daily. I've discussed how to brush in my previous video. You can go back and check it. The first thing is brush twice daily, in the morning and the last thing before you sleep. That is number 1. Number 2 is floss once daily. Dental floss. Use a dental floss to floss your teeth once daily. That's number 2. Number 3, don't forget that whenever you brush your teeth, you must brush your tongue. In fact, it is better to have a tongue scraper to scrape your tongue, because whether you like it or not, most of the causes of bad breath in our mouth come from the tongue. You may not believe that. So please, whenever you brush your tongue, get a tongue scraper and scrape your tongue. It's very important. That's number 3. The next thing you have to do if you want to eliminate bad breath is rinse your mouth occasionally with mouth rinses. Very important, especially the ones that contain Listerine. It's very, very important. Use it to rinse your mouth. I tell my patients that if you are using mouthwash, make sure you use it in the afternoons. Maybe you are in your office or at your workplace. Just get a rest to use it, rinse and throw it away. Once a day is enough. That's the next one. The last one is occasionally or periodically make sure you visit your dentist. It's very, very important, because some of the causes of bad breath is what we call accumulation of plaque and calculus, and these accumulations cannot be removed by just brushing or flossing. So you have to see a professional, you have to see a dental therapist or a dentist for them to remove the plaque and calculus from your gum. They also contribute to bad breath. So it's important you do all this. Now, if you have done all what I've mentioned above and you still perceive bad breath, that means it is not due to poor oral hygiene. There are other causes of bad breath aside poor oral hygiene that I've discussed. One of them is dry mouth. Dry mouth can be as a result of a malfunction in your salivary gland. Salivary gland is what produces saliva in our mouth. So if there is a malfunction in it, that means you won't be producing enough saliva in your mouth, and that can cause bad breath. Dry mouth can also be caused by some medications, antidepressants, antihypertensives, and some other drugs. So if you notice that you are taking some medications and they are causing dry mouth, it can be a cause of bad breath. So see your physician, take care of that. If it is as a result of salivary gland problem, take care of it. Another thing is cigarette smoking is another cause of bad breath. Of course, everybody knows that, and the solution to that is to quit smoking. Smoking also enhances dry mouth, and so it can also exacerbate bad breath. Also, there are some systemic conditions that can manifest as halitosis in your mouth. In that case, you will have done whatever we have discussed above and it will still not go. That means there is a systemic problem that you need to take care of before your bad breath can go away. Renal disease can cause bad breath. That is kidney disease. liver disease can cause it, diabetes can cause it, gastric diseases can cause it. So if you notice you have any of this, it's better you consult your physicians, let them diagnose you, treat you, then the bad breath will go away. The last cause I would like to discuss is what we describe as psychogenic halitosis. I've seen many patients come to my clinic, they complain they have bad breath, and when we check, you examine, you test, they don't have. So we term it psychogenic halitosis. So they just feel they have it. They just have it in their mind that their mouths are smelling, whereas it is not. So it's a clinical condition that your psychotherapist will have to deal with. So you have to see a specialist in that case. Most of the time I refer my patients to psychiatrists to get better treatment. Once they are treated, that feeling will go away. So that will be the end of today's episode. Hope you have learned one or two things. Thank you for watching. Please like, subscribe and comment on my videos. See you on the next episode. Thank you.